Hey everyone, welcome into our latest TDR International Weekly Recap presented by Prohibition Partners. I am your host, Shad Dales. What is going on with Germany? Yes, it's growing fast, but there's still some concerns that's coming down about the government. So we'll take a look at that and the new capital rules in Germany to pharmaceutical breakthrough in chronic pain and a whole lot more. So here's what you need to know on our latest TDR Weekly International Recap presented by Prohibition Partners. But first, a quick word from Morgan & Morgan. Hey everyone, there's a reason smart investors celebrate when their portfolio jumps 40% in a year, just like there's a reason Morgan & Morgan is America's largest injury law firm. Think about it. When you're investing, you want the right team in your corner. The same is true if you're injured in dealing with an insurance company, and that is where Morgan & Morgan comes into the equation. Why? Well, they've got more than 1,000 attorneys and over 100 offices nationwide, and they've been fighting for people for over 35 years, and their track record is hard to ignore. Let me explain a little bit further. Case in point, in Florida, a client was offered $350,000, but walked away with $12 million. In Pennsylvania, another client, they turned $650,000 offer into $26 million. That's a 40x return. So in total, Morgan & Morgan, they've recovered more than $25 billion for over 500,000 clients. So really, when you hire him, it's like bringing in a legal army that has your back. Because if you're injured due to someone else's negligence, you deserve to be paid. And let's be honest, not all law firms are created equal. But with Morgan & Morgan, their fee is free unless they win. You can start your claim right now by clicking the link in the description below or by scanning this QR code on your screen with your phone. At the end of the day, if you want what you deserve, make sure you go in with the right team by contacting Morgan & Morgan today. Now, let's get back to the rest of our video. All right, let's get into it. First up, Germany's BaFin. They just sent shockwaves through the cannabis finance world. Plant-touching businesses must now face the same disclosure and auditing standards as pharmaceutical companies if they want to raise capital from retail investors. So what does this mean? Well, in plain English, no more shortcuts. Companies will now need full prospectuses, audits, and compliance transparency to tap the public money. So why does this matter? Well, this isn't just liberalization, it's professionalization. BaFin is telling the industry, if you want real investment, you need public company discipline. As we know, Germany's cannabis market is growing up fast, but with that, there's a lot of red tape that's starting to be inserted. So is there concerns about Germany and how fast it's growing and some of the red tape that's now being implemented? One to watch as we see this progress throughout the year. All right, let's now move across the channel. In the UK's National Health Service, quietly, they hit a milestone this week. The first NHS prescription for a cannabis-based medicine dispensed through a mainstream pharmacy. So it's a small step, but symbolically, this is big. So why does this matter? Well, the UK's postcode lottery for medical access might finally be shifting. Even a handful of NHS prescriptions could open the door for more doctors to consider cannabis as part of a standard care and really eventually normalize prescribing across the system. Whole lot different when you focus on what's going on here in North America to what is going on overseas. Still early stages, but upside potential. Next, let's move to German pharma firm Vertanical, who is nearing market approval for VERO1. That's Europe's first multi-compound whole plant cannabis medicine. Phase 3 trials with 800 patients are now complete, and regulatory review is underway in Germany. So this could be a monumental moment. So if cleared, VERO1 could hit markets in Germany, the UK, and the US by 2026. Yeah, that's next year. Another reason why we need proper research and reform in the US as well. So why does this matter? Because as we know, this could be the first internationally authorized non-opioid chronic pain drug made from the whole cannabis plant. So it's a massive step forward for cannabinoid therapeutics and investor confidence in cannabis pharma. Indeed, it is. Next up, keeping on this topic of Germany, where Germany's domestic cultivation scene is expanding again, 4 new companies have applied for medical cannabis grow licenses. They include Aurora, Tilray, Demacan, and the original license holders. One newcomer, which is German Cannabis Standards, has already raised 10 million euro to build a 21,000 square foot meter production facility in Bitterfeld-Wolfen. Check that out in your GPS. So again, why does this matter? Well, local cultivation is now a strategic necessity, not a formality. So when you have domestic supply expected to meet both patient and research demand, the race for GMP certified production is definitely heating up. Next up, PHCANN CEO Dr. Sasho Stefanowski told Business of Canada this week that the next chapter of cannabis pharma will be built on trust, not hype. The EU GMP certified producer is launching its exotic line in Germany and the UK. Will focus on stability, traceability, and pharmaceutical QA. So again, why does this matter? Because it's Europe's medical market is maturing, moving from buzz to biotech discipline. So PHCANN's approach, it'll show that cannabis companies are thinking less like growers and more like pharma innovators, something that's badly needed for this space since day one. Let's now switch to South America, where Brazil's regulatory process, it remains frozen almost a year after its Supreme Court ordered the government to create domestic cultivation rules. ANVISA still hasn't acted. So civil rights society groups, they're definitely pushing back now. They're warning that continued delays will keep Brazil dependent on imported cannabis medicines, which already serve over 670,000 patients. So without domestic cultivation, access and affordability stay out of reach for many. And for a country with one of the world's largest patient bases, there's a missed economic and humanitarian opportunity here. So to sum up this week, Germany is professionalizing, the UK is softening, and Europe is innovating, and Brazil is still, what do we know? Waiting. This has been the latest TDR Weekly European Recap presented by Prohibition Partners. I am your host, Shad Dales. Let us know, comments below. What do you think's developing over in Germany? Any concerns? We'd love to get your feedback, so let's keep this conversation going. As usual, if you like this breakdown, make sure to give it a like, smash on that bell for all notifications, and subscribe to us here at TDR. That's it for now. In the meantime, enjoy the rest of your day. Like I always say, stay open-minded, stay connected, and I'll see you in the next video. Thanks again for watching, everyone.